Hello, and welcome to the North Coast Journal Preview, where we take a look at the stories being covered in the current edition of the North Coast Journal. I'm your host, Dave Frank, and I'm joined today by Thad Greenson, news editor, and Jennifer Fumiko Cahill, arts and features editor at the North Coast Journal. Welcome, guys.
Hi, Dave.
How you doing, Dave?
Happy 2022.
Yeah, pretty big bang into the new year here, 2022. We're back on the block, and unfortunately, it looks like we are covering Omicron. You guys have shared with me the cover illustration, and it says "uh-oh" with a big O. So with that in mind, Thad, why don't you tell us a little bit about "uh-oh" this week?
Yeah, so I think that those of us who have been watching the stuff closely, nationally and globally, have kind of been girded for the arrival of Omicron here in Humboldt County, and I think most of us would probably guess that it's been here to some extent, just with the rate that it has spread through the state and the rest of the country, even though we didn't have a confirmed case. And so, Monday, fresh off of New Year's festivities and trying to turn a page and have a fresh start and all that kind of stuff. We were kind of slammed with the double news, that the county had confirmed 400 new cases of COVID over the weekend, which is just an astronomical number for Humboldt. It's a single day reporting record, but it so far eclipses what we've had on prior holiday weekends, and that even covered 3 or 4 days of testing. So it was a really big number, which was jarring. And then with that, there was also the announcement that the county had confirmed the first 2 cases of Omicron here. And that these confirmations, didn't come in real time, but came from genomic sequencing on samples taken back December 19th and December 20th. So at this point, it's a pretty, very good indication that Omicron had already been circulating in the local community for a couple weeks prior to this report of 400 cases. And then so we at the Journal, kind of quickly pivoted to thinking that, from the story that we had planned to thinking, we need to do something to really make folks aware of what Omicron is and how it's different than Delta and prior iterations of this virus, and kind of the best at the moment science that there is on what this thing is and how it transmits and what it means for all of us.
So with that in mind, and thank you for that little primer on kind of where we are, the article's comprehensive and covers a whole variety of the aspects of where we are now here in our community. But I think a really good place, and again, not to get super in the weeds on this, but a really good place to start is, we hear a lot in the media, and then also, just in our social circles about, hey, this is different. This strain is different. This variant is different, and maybe not quite as bad. Can you fill us in on a little bit of the high level difference between Omicron and kind of what we've experienced in the past with Delta and other variants?
Yeah, definitely. So I want to preface everything in this conversation with saying that the science is just really new and data is just kind of steadily emerging on this. This strain was just discovered, about 2 months ago. So everything is very fluid. But, the best indication, what's clear is that Omicron is traveling much faster than Delta and in prior iterations of the virus, and is much more transmissible in some way. And what the best available science kind of says about that right now is that it's primarily 2 reasons. One is that the 50 mutations that make Omicron its own variant, for some reason that we don't really understand yet, makes the virus very effective at infecting cells in the nasal passage and kind of the upper respiratory system, but seemingly not as effective at getting down into the lungs, which is a good indication for the rates of severe illness, which I'm sure we'll get to in a moment, but Also might mean that because it lives more in your nasal passage, that you emit more aerosols, and it's more present in the aerosols you emit when you breathe. And so therefore it's just there's more of it that's airborne when somebody is infected with Omicron. But likely the more meaningful difference is that it's very evasive of antibodies. Antibodies do not seem effective with it. And so whereas there were breakthrough cases of fully vaccinated people or reinfections of people who had the virus before and then got reinfected with Delta, they were pretty rare, and the thinking was that while those were possible, vaccination was a pretty good protection against both getting infected with the virus and transmitting it, even though both those things were possible. And with Omicron, it seems, in the preliminary data that fully vaccinated folks are essentially just as likely to contract the virus and then just as likely to transmit it once they have it. So, obviously with, in Humboldt County, 60% of the population fully vaccinated. With Delta, that really hampered the spread of the virus. And with Omicron, it seems like all of those fully vaccinated people are just as risky as unvaccinated folks of contracting the virus and then spreading it to the people around them, which really you can see why that would account for a much more rapid spread. The very, very good news so far, knock on wood, is that the vaccines, preliminary data anyway, suggests that they remain very, very effective in preventing severe illness, hospitalizations, and death, even with Omicron. And so we don't have a lot of good data on this in the United States at this point. We have a lot of anecdotal evidence, but the British, I can't remember their official term, but British health officials, Omicron arrived there far earlier, and so they analyzed 1 million COVID cases in recent weeks and released some data about vaccination. And what they found is that folks who were fully vaccinated, had 2 doses, were 65% less likely to be hospitalized with Omicron than folks who were unvaccinated. And then folks who had a 3rd dose, a so-called booster shot, were 81% less likely to be hospitalized with Omicron than folks who were unvaccinated. So the preliminary indications are that it remains very effective in preventing severe illness, which is really good.
Yeah. What's interesting about statistics too is depends what direction you look at them. So if something's 65% less likely, then it's 3 times more likely. And if it's 81% less likely, then it's 5 times more likely, because you have to get up to 100.
Yeah.
So with that in mind, I mean, I guess what's really important for folks is to figure out, or at least, not that you are the be all end all arbiter of people's behavior and insights into this. It's so preliminary. We're talking about surface level stuff. But like, how this is going to impact our community. And more importantly, I would say from the beginning, sort of the common thread of understanding that we've had with people is when we say, look, we are looking to prevent the hospitals from getting overwhelmed. I mean, ultimately, that's the basis, is to stop this catastrophic impact on our healthcare system. So what do you think, just from your article, what you've covered so far, how the sort of the impact of what we see so far on our community, on the people of our community, and also on the hospitals in our community?
Yeah, so the hospitalizations in Humboldt have kind of plateaued. They reached a peak during Delta of, I think it was 43 hospitalizations in early September, which really had, I don't know if folks remember some of the reporting at the time, but really had the local hospital systems overwhelmed and stretched incredibly thin. And that's, I think people talk about ICU bed capacity and how many hospital beds are in Humboldt County, and those are kind of, I think, the points people focus on. But really, the data point that people need to pay attention to is available people to staff, trained people to staff those healthcare beds. We're going to have far more beds and far more ICU beds than we have trained nurses and trained doctors to staff them. And so that's really our limiting factor here. But so, we haven't felt an impact on as far as hospitalizations from Omicron or this recent kind of post-holiday surge yet. I think the recent hospital numbers were about 12 people hospitalized with COVID in Humboldt County. The thing for, I think, readers and viewers and listeners to note, though, is that our hospitals, system, because it's so small, is just really fragile, and that can change really quickly. And so, in the cover story, I did some real kind of back of the hand math, and figured that, I think it was about 5% of local cases have led to hospitalization throughout the course of the pandemic. And so even if we say Omicron is less likely to result in people being, maybe it's half as likely as to result as people being hospitalized as prior iterations of the virus, from Monday's report of 400 new cases alone, that's 8 people being hospitalized. And those numbers trail behind the case numbers. And so I think, I've seen in comments and heard from some people, who saw the 400 number on Monday and said, oh, well, there was only one person hospitalized in that report, so it can't be that bad. But it's important to remember with COVID that hospitalizations, trail, a week or so behind case counts. And so, anybody who's in that batch of 400 on Monday who's going to get sick enough to be hospitalized, that we won't see that for a week or so, because it takes a while for the virus to take hold to a point where somebody gets sick enough to be admitted. And then the other thing is that, when somebody's hospitalized for COVID, they typically stay for 10 days to 2 weeks is kind of the average. And so if those 8 people are hospitalized, next week, it's not like they're going to be discharged the next day. They're going to be there for a while. So there's this cumulative impact. And again, our hospital capacity is just very fragile. So, I think that's something for people to really keep in mind, is that there's just really a small margin for error here in Humboldt County. And that's kind of something we've wanted to stress to people repeatedly.
So there's this number I've heard thrown around and seen in media that 1 million people nationwide were affected on Monday, and Johns Hopkins data, and that New York Times sort of interpolates that, figures it out, and carries an average. And as of yesterday, I think the average was close to like 480,000 people per day. But it's going up, and it's here. Like we're in this wave right now, and that's why we're seeing this writ large is kind of reflected in our local numbers of 400 on Monday. But we don't know what's going to happen. But I guess just to help you make a fine point on this, that's the 8 people from Monday, and then
right.
but then there's every day through this wave, which could be a week or 2 or 6, and that could be pretty awful.
Right. There's 188 yesterday. So that's, theoretically another 4 people. Then there's probably, going to be a similar number today. So there is that cumulative impact. Absolutely.
And so I heard you say recently that the public health office is going to have an announcement relatively soon. I'm sure that you'll cover that in going forward once you get a chance to check in on that. But just to kind of wrap up our overview of this, what's the lesson for people at this point? If there's a lesson, or a guidance, do we have any preliminary guidance from the health experts about how our actions ought to be impacted by this new information?
Yeah, I think there's 2 major takeaways. I mean, the first is that anybody, any of us who are thinking that full vaccination or having a booster is not just a prevention from them getting really, really sick, but will insulate them from catching the virus and spreading it, that they don't need to worry about visiting, their unvaccinated children or their older at-risk grandparents or anything like that, is, all of that has vanished. Everybody needs to understand they have an equal chance of catching this virus, carrying it, and transmitting it to somebody else, and really acting accordingly. And then, one thing that we included in the cover story that I thought was just a really good, metaphor and a really good point, is that I think so often throughout the course of, this almost 2-year-long pandemic now, we have focused kind of myopically on like a single mitigation measure, whether it's shutting down schools or shutting down businesses or masking or vaccination. And really, we need to keep in mind that we need a very layered approach. And so Andy Slavitt, who was on the Biden administration, advisor to the Biden administration's COVID team, had made a point that I thought just really was salient, that, he calls it kind of the Swiss cheese approach, which is that basically all of these mitigation measures have holes in them. Masking isn't flawless. We now know vaccination isn't flawless. Distancing isn't. All these things, are not impenetrable. And so they're kind of like Swiss cheese. There's holes. Some have smaller holes, some have bigger holes. And the trick then is to just layer them. And if you get enough layers, then you have the best chance of kind of having that impenetrable barrier. And so it's not enough just to be fully vaccinated and boosted and then go along about living your life. confident that you're not going to infect anybody else. You need to make sure you have a mask, make sure you have a good one, make sure you're wearing it properly, mind distancing things, being mindful of not mixing with other households. And, it's disheartening, but for a while we're kind of back at that square one where we need to make sure we're checking all those boxes if we want to keep our, ourselves, our family members, and our community safe.
Well, thank you for this comprehensive overview and for being the bearer of bad news. But I would say we're resilient enough to to take this information and learn from it and act on it. So to be continued. We'll check in on this in future weeks, I'm sure.
Sounds good. Thanks, David.
How about you, Jen? What is going on the arts and features beat this week?
I thought for a change we'd talk about COVID.
How did I know?
I know, because every time something happens in our case counts, in our test positivity rate, in a new variant, that has shockwaves around the community, of course, in all businesses, and particularly for restaurants. And restaurants and food businesses are very much like the, I don't know, I feel bad for the canary in the coal mine, because that was like on purpose, right? You brought the canary with you. They're more like frogs, right? Frogs are the first ones to feel environmental impacts. So I checked in with some of my favorite frogs. There are some folks that I've been talking to throughout the pandemic about how they've been coping, and about how they've been kind of rejiggering their businesses, either in terms of services, in terms of staffing, and sometimes in terms of physical environment. And it's been quite a ride. A couple of the folks that I've been talking to for a while include Nicholas Cole, who owns Oberon Grill in Old Town. And I remember I talked to him from the very beginning, the minute we had lockdown. And he had already started spacing tables. He was trying to figure out, based on what we knew about the virus at the time, how to go forward, how to stay in business. And now, checking in 2 years later, he's again trying to figure out, okay, what do I do? As soon as the numbers came out, as soon as he saw that 400, he started thinking, okay, I got to do a refresh on all of our safety protocols, kind of like a refresher course for the staff. He started looking at, he pared back tables down. He's going to 25% fewer tables. He's wondering if Arts Alive is really going to happen this weekend, or if people will turn out for it. And that's a big moneymaker for places in Old Town. So he's trying to figure out what is happening. And interestingly, he told me that he was optimistic, and that even though things are looking a little terrible, it's still better than last year. Last year, he said he was getting on a crab boat. He had signed on to be on a commercial crab boat, shut down the restaurant completely, couldn't sit still, and was like, I'm going to go face my fear of water and do this. And so he's like, I'm in my restaurant this year, and he's trying to, make it work. I spoke to some other folks. Meredith Mayer of Six Rivers Brewery, she's another one that we sort of checked in with here and there, because she and her co-owner have been working really hard to make an outdoor seating area. They've really tried to adapt. They've reworked the entire way they do service, and they've been basically having staff meetings where they make decisions. And Meredith got the Rona. Unfortunately, she was exposed over the holidays at a gathering. And it was interesting, because she was saying that one of the things that she really focuses on, and that her staff focuses on, is ventilation. So in Six Rivers Brewery, even if you're eating inside, you feel like you're outside, because they've got all the windows and doors open. The staff has logo parkas. And, the outdoor patio is probably warmer with the heater. But anyway, they do have, takeout, outdoor seating, and indoor seating, but with windows open. And she was at this gathering, with friends, people who were vaccinated, but at some point it was really cold outside where they had gathered. And then they decided, okay, let's move it inside. And she had thought to herself, it's kind of tight in here, not really ventilated. We're going to be eating and drinking. And she second guessed herself. And then she was like, well, we're paying for it now, because a few people ended up with COVID. And, she was saying that she's trying to keep up, that they're doing everything they can. and she's optimistic too. She said, January is always terrible. So they're doing the best they can. The staff is doing their best they can. But, she also talked about how she's thrown more people out of her establishment in the past, year or two than she has in the whole history of the place, because people have just kind of turned into monsters.
Yeah.
All their frustrations, as I mentioned last week, you don't see people doing this at banks.
Right.
Or real estate offices. And yet, when they go into a restaurant, sometimes other retail establishments, they decide, I'm not going to follow the rules. I think the rules are stupid. And in some ways, it is frustrating, right? You're sitting there, you have to wear a mask to go, say, to and from a bathroom or in and out of the restaurant, but you're sitting a foot away from other people with your mask off, eating and drinking. Servers are wearing masks, but it's, at some point you're looking around and you're like, is this safe?
Right.
Is this kind of like, taking my shoes off at the airport? Like, how much is this actually doing? I, myself personally, I'm not eating indoors at restaurants. It doesn't feel safe to me. It doesn't feel like the experience I want. I'm a takeout girl right now. And in fact, the supervising public health nurse responded to a journal email by saying that your best bet for safety right now is takeout. And if you really want to dine at the establishment, sit outside. And she goes a step further to say, sit outside with people that you already live with, people from your household. Don't mix households. And that's because you're going to have your masks off. You're going to have your masks off, eating, drinking, talking, aerosols flying back and forth. So you might as well be with people who are already in your household bubble. Things are changing. It feels unfair. It feels frustrating, but this is it. We got to live with it. I spoke to another person who works in restaurants who asked not to be named. And they were expressing what I've heard a lot of people who work in restaurants express, which is utter frustration with angry people who don't seem to care if they make other people sick. And there's just been a real wave of people who, lie, make excuses about, I've got a doctor's note. Where's the note? Or I've got asthma. Why are you out in a pandemic having dinner somewhere? And it's been really frustrating for them taking the abuse, having people call them names, having people, shout profanities at them. And they were telling me that, of the people they know who've left the service industry, how you always hear like, oh, everybody's trying to hire and nobody wants to wait tables anymore. Partly it's, if you've been working in the service industry, you're used to a little bit of struggle. You're used to hard work. It's a grind. It's the abuse. They were telling me that more people they know have left the industry because of angry, entitled people mistreating them.
Yeah.
And it's frightening at this point because that angry entitlement leads to people not following the rules and, exposing people unnecessarily. Granted, when you are eating and drinking, again, your aerosols are flying around and some people say, well, what's the point? But again, if we're taking the layered approach, if we're trying to do as little harm as possible, then yeah, wearing your mask for some of the time when you're moving about a restaurant matters. Making it so that a server can step away from you after a brief interaction, following the rules matters. And saying that, well, this doesn't matter at all, so I'm just going to do the worst possible thing I can do. That's ridiculous and childish. My kids don't even give me this. Not anymore. But I think it behooves us to look at, as we've said before, it behooves us to look at whether we are treating the restaurant industry and it's, between the businesses and the people who run them and the people who staff them as disposable. A small inconvenience to you could be just the thing that breaks their back. Whether in terms of financially or in terms of, just their mental health, the stress of trying to be cheerful and give service with a smile in the middle of a pandemic that has you afraid. it might be too much to ask. So if you are going to dine out, if you are going to be at establishments instead of just doing takeout, really think about how your behavior is going and multiply it by 100 and ask yourself if that's the day you want.
Well, thank you. It's very stressful, like you said, for them to be on the front line. I think we need to treat them with the respect that frontline people ought to be treated for being there for us. One of the quotes in there was that everybody wants things to be normal, but it's stressful to be normal.
Yeah.
Well, thank you so much, Jen, for this frontline coverage. Thanks again, Thad. That's about all the time that we have this week. Until next week, North Coast Journal is available on newsstands now. Pick one up, stay informed. It's also online 24/7, so you can check it out. Check out these articles we talked about, and as well as any others. Until next time, take care, both Thad, Jennifer, and everyone out there. Take care as well.
Be safe.